This maternity care center, in some ways, was really a risk. It's going against the grain of what's happening in our nation, and also regionally. As you said, 8 hospitals in North Carolina have shut down in the last 10 years. And those have been places, they're smaller, rural, even critical access hospitals with maternity care. And so it's a reversing trend. It also, it's that partnership also with UNC Health that's allowed us to take this risk and allowed us time in which to show essentially a return on investment. And I'm not just talking dollars and cents return on investment, although I think we're going to see that. We're talking about the kind of significant money you spend to try to get a physician or provider into a rural setting and stay there.
For me, the return of investment is really hoping to make a change in this maternity care crisis. Black women and women of color are not dying at 3 to 4 times the rate of white women. To me, that's just even hard to say as a woman of color, because it affects just me. It doesn't just affect me, it affects people I know. And to me, that's a most important kind of return on the investment that we need to make in maternity care.
So we got to stop thinking just of dollars and cents in the immediate, what we get reimbursed for in terms of a birth or taking care of a newborn. But downstream, what does it mean to have wraparound care so that women get the support that they need to breastfeed? Women get the support they need to be at home in that definable period that they choose to care for their young. That also expands to the family, and not the traditional necessarily family, but the family as they define it. So many barriers to break down that go way beyond this medical entity. It really is, what can we do in this care model? Can it be reproducible? And there are other places in the United States that have this kind of model and that it is sustainable.